Hi, everyone. My name is Mubarak Ayani. I'm the founder and CEO at Betalife. Yeah, at Betalife, we're a digital operating system for blood supply in developing countries. On the 5th of May 2022, I lost my aunt due to postpartum hemorrhage. We waited over 72 hours to get a compatible match, but unfortunately for us, she lost her life. Aside my aunt, 8 women out of 1,000 died during childbirth. Today's blood supply system in Africa is inefficient and expensive. Patients record 4 days delay before they could get access to their blood. Healthcare facilities spend over $60 per pint. We face issues of fragmented supply chain. We also face issues of mismatch errors. How are we solving this problem? With our API infrastructure, we are able to connect the demand and the supply. When we talk about the demand, guys, we talk about the patients, talk about the hospitals. And we talk about the supplies, guys, we talk about the blood banks and the donors. So Betalife, with our AI-powered digital blood supply platform, we are able to save a lot of time. Patients that have to wait 4 days before can now get their blood in just 2 hours. Also, with our smart inventory, blood banks can be able to forecast demand. In that way, they're able to streamline operations and reduce wastage, ultimately saving more lives. We are also able to optimize logistics, reducing costs by 25% for hospitals. We are also able to compatibly match patients with the compatible blood types they required. We have our products live on Apple Store and Play Store, just like you can see here. Patients at any point can simply request for blood and they get their blood delivered to them in due time. We also have our web dashboard that allow hospitals request for blood on behalf of patients during emergency, and blood banks can simply accept these requests and get the blood delivered to them in due time. The demand for blood, according to Alive Market Research globally, is about $15 billion. And we are targeting West Africa and African markets, and we are looking at a market share of about $80 million in Nigeria. How do we make money? We charge $10 as connection fee for connecting hospitals and blood banks. We also charge these blood banks $20 as a subscription fee for using our platform. How we are growing rapidly, as you can see, by the end of 2025, we'll have onboarded 50 hospitals, which allow us to record $50,000 in monthly recurring revenue. We are also going to reduce blood wastage by 30%. We're also going to have impacted over 75,000 lives. We're also going to improve the patient's outcome by 10%. We're also going to save over $200,000 for our healthcare facilities. How are we different? How are we unique? Better life. At Better Life, time matters to us. We are promoting real-time communication, as you can see here. A timely blood transfusion would mean the difference between life and tragedy. If you look at our competitors, they operate the traditional system, and this causes a lot of time wastage. Our team is made up of what young and vibrant individuals who have committed themselves full-time in building better life. As an healthcare specialist, this has positioned me well to building the solution. As you can see, my co-founder with over 10 years as a full-stack web developer. And we also have Irene Kivia with over 15 years in marketing, media, and communication. We also have Dr. Ademola Adewoyi, who have over 16 years experience as a consultant hematologist and has worked with notable labs like Synlab and Evercare Hospital. We are looking to raise $400,000 to accelerate our product development, hire new talent, and skyrocket our market expansion. What does our customer say? We've partnered with the National Blood Service Commission, and currently we've piloted with the National Blood Service Commission to allow us demonstrate our product feasibility. We also partner with the Federal Ministry of Health, which would give us access to over 100 hospitals by the end of 2026. Better Life is growing rapidly, so don't afford to miss this train now. As you will all agree, blood cannot be manufactured, and the demand is going to be till the end of time. We have thousands of accident victims out there. We have patients undergoing chemotherapy. We have all our mothers in need of blood during labor. We have a lot of sickle cell patients out there. We have a lot of people undergoing heart surgeries. They all need blood. If you think you care for those who care, at Betalife, we are ready to talk to you. Thank you all for listening.